Do you provide pain management to somebody you know who's drug seeking? What's up, guys? EMT 2319 here. Pain management, drugs, intoxication. I want to get a little discussion going with you guys, get some input from you guys on, what you think about providing pain management to somebody who you know is drug seeking. So we're talking about patients that we think are, can't get drugs on the street, so they're looking for the paramedics to provide them drugs. This could be your frequent flyers. This could be your, patients you haven't seen before, and anything in between. You spend enough time in patient care, you kind of get an idea on whether or not somebody is actually in pain or if they're drug seeking. We all know that, there are vital signs that change, that peak, that increase, that adjust to compensate for somebody who is in legit pain. And when we don't see these vital signs changing, or we just kind of have that general gut feeling based on knowledge and experience, we have a tendency to go straight to drug seeking. This person is looking for drugs. So is this the right answer or is this the wrong answer? I honestly don't know. What I can tell you is that I've seen this exact behavior both by field clinicians and ER clinicians. And here's my take on it. Again, full disclosure, this is my opinion alone. I'm sure I'll have some people out there supporting me. I'm sure I'll have some haters out there, okay? But this is strictly my opinion, guys, okay? Now, although there's some clinicians out there that will make the argument that they don't care whether or not the person is drug seeking. That's not their purview. If the patient is complaining about pain, they're going to provide pain management accordingly. And, that's fine for them. That's the way that they want to practice, and there's nothing wrong with that. I personally have a very difficult time getting behind the idea of providing pain medication to a patient that I know and or have a very, very strong suspicion is drug seeking, that is not actually in pain. It's my opinion that this is reinforcing negative behavior. It also reinforces the ideology that if the drug seeker is unable to acquire their drugs on the street, they can call 911 and the paramedic will give them the drugs that they're looking for. I just can't get behind that. Okay. I have a very hard time swallowing that pill. All right. Now, I will say that if there's any doubt in my mind at all on whether or not this person is actually drug seeking or they're actually in real pain, then I'll provide the individual with the appropriate pain management protocol. Okay. I may start off with a non-narcotic first and go from there. Who knows? Situation is going to dictate. But either way, I want to get, some insight from you guys. I wanted to get some opinions from you guys on this and see where everybody stands with the idea of providing pain management to somebody who could potentially be drug seeking. Please feel free to leave your insight and your thoughts and opinions in the comment section. I'd love to hear from everybody on this topic. Okay, it's a hot topic right now. One reminder, I'll be doing a jump bag giveaway on August 28th, which is my graduation day from paramedic school. I'll be putting a video together displaying the bag and its contents, hopefully today or tomorrow. All you have to do is like, follow, share, and enter your name into the comments, and you'll be entered into the raffle. Okay. You can enter as many times as you want by like, following, and sharing, and placing your name into the comments of, any one of my videos or all of my videos. So let's get as many people involved in that as we can. Okay. Remember, guys, keep your inner circle small, and steel sharpens steel.